Coming up on this week's edition of Being Well, our topic of discussion will be digestive health. My guest is Dr. Robert Good from Carle Foundation Physicians in Mattoon. Dr. Good will address common digestive problems like acid reflux, irritable bowel syndrome, and colon cancer. He'll also provide us with some advice on how to prevent common digestive problems. That's just ahead, so stay right here. Well, Dr. Good, thanks for coming on Being Well, and we're talking about something you deal with all the time, and that's digestive issues. What are the most common digestive problems that you see in your patients?
Well, probably if you had to look at the top three, it's acid reflux disease, irritable bowel syndrome, and diverticular disease.
Mm-hmm. We know what acid, give us a little explanation of those three.
Well, acid reflux results in what we refer to as heartburn. People have a pain in their chest, in the pit of their stomach, and that causes discomfort. It's got a whole different batch of causes, but
we'll get into those in just a minute.
But, and then there's irritable bowel syndrome, which is kind of connected.
And then
diverticulosis.
Yes, what's that?
Is a condition in which there's little pockets or little weak spots in the wall of the colon. And it's genetic. It tends to occur in the more mature population.
At what point, why, I'll ask this first, why is it important to pay attention to our digestive health? Why is that important to, keep track of that?
Didn't your mother tell you you are what you eat?
Yes, that's true.
There you go. That's why it's important. We really are the building blocks of our body is based upon what we consume, and nutrition is extremely important.
So why do you think are you seeing more people with more digestive issues than you did maybe 10 years ago?
I think there's probably an increased frequency and probably because of the incidence of soda pop that's being drank.
Let's talk about that.
Yeah.
That's a culprit for a lot of things.
It is.
It's kind of complicated.
Yeah, I mean, when we consume large quantities of a carbonated beverage, it's the carbonation, the air that gets entrapped into the digestive system, and it makes people want to get rid of that air, either forcing it down to the digestive system or belching it back up. And that's reflux. That causes problems.
Okay. What about, we're as a society sometimes not the best at what we eat. Probably don't eat as many fruits and vegetables. Is our diet, lots of fast food, greasy things, probably contributing to our digestive issues?
Yeah, I mean, the purpose of bulk, of vegetables, of fiber, is it keeps the colon softer, less straining, and any time that the abdominal muscles are contracting, it squeezes on the stomach. And if the stomach is full, it increases the risk for reflux disease. So, yeah, it has a direct relationship to reflux. It has a direct relationship to how our stomach feels.
At what point do you recommend, if someone, acid reflux, heartburn, we've all probably had that. At what point do you recommend people come in and talk to their doctor? When does it become something more than just a nuisance and could have some serious side effects later on? Yeah,
I think that the biggest concerns is when food gets stuck, where people cannot swallow properly. If there's weight loss involved, that's significant. If there's increasing pain, and the pain doesn't go away, because esophageal cancer is also increasing in our society, and probably as a result of reflux. Reflux can cause a change in the cell type at the bottom of the esophagus. That's called Barrett's esophagus. And that change, if it occurs over a longer period of time, particularly when it's exposed to alcohol and tobacco on a regular basis, can turn into cancer. So esophageal cancer can oftentimes present like heartburn.
Do people sometimes think they may be having a heart attack when it's really heartburn or acid reflux?
Probably the most common presentation to the emergency room with chest pain is related to heartburn.
Okay.
But you cannot, that's another topic, but you cannot assume that because you cannot tell the difference between the two. They both are affecting smooth muscles in the middle of the chest, they will feel exactly the same. And so obviously a heart attack is fatal or can be fatal,
Right.
and so you don't want to mess around with that. You want to get to the emergency room for care.
Okay, so what are some things that we can do to prevent acid reflux?
Well, one, don't drink carbonated beverage.
Darn.
Yeah, sorry.
I like my soda every now and then,
Yeah.
or every day.
Yeah, I think that staying away from carbonation is a good idea. Eating foods on a regular basis, not overfilling the stomach, and that includes overfilling it with water.
Oh, really?
Large quantities of water. Once you put water in the stomach, it's now acid water. And if you get into a position, laying down, for instance, water can seep back up into the esophagus and cause irritation, cause a heartburn. Not eating and drinking before bedtime is another way to kind of prevent heartburn.
Now, is acid reflux, is that like the stomach acid kind of bubbling up into your esophagus, or really what's happening inside your stomach?
Yeah, there's kind of two things that happen there. One is the acid effect itself, and the esophagus likes to run a pH kind of neutral, kind of like 7. The stomach has a pH of around 3, 4. And when acid gets up into the esophagus, it's in a place where it doesn't want to be, and it can cause burning of the base of the esophagus. You can actually get ulcerations and swelling, and it can be kind of ugly looking directly at it. Yeah. But there's also people who have NERD, not just GERD.
Okay, yeah, let's talk about GERD and NERD.
Yeah, some people are nerds, what can I say? No, basically it's non-erosive reflux disease, in which it's not really acid it's causing, it's food substances that kind of lay or get into the base of the esophagus. A common problem are pills. People will take a tablet for some other medical reason at nighttime or even in the daytime and lay down. The pill doesn't get all the way into the stomach and can irritate the base of the esophagus. Probably the classical right now, the use of bisphosphonates, which are used to treat osteoporosis. Those really got to be taken in an upright position.
Okay.
But all pills should be taken that way.
Yeah.
Don't take a pill and lay down.
Well, let's just, as long we're talking about pills, talk about some of the over-the-counter remedies that we may think are doing us a favor when we've got heartburn, but actually they may not be.
Yeah, I think that any antacid will kind of put the fire out.
Right.
Okay. What you have to be careful of are calcium-based antacids taken without something else, because they'll absorb the acid, and as they get into the stomach, they'll clear, and then the stomach will produce even more acid. Dairy products will do that because they contain calcium. But items like Maalox, Mylanta are fine, and they probably are the fastest way to make people feel better. The use of what we call H2 blockers like Tagamet and Zantac, which are ranitidine, cimetidine, they're also helpful. But the most powerful are medications like Prilosec or omeprazole, Prevacid. You can buy those over the counter to help with the discomfort.
Because those actually make your body produce less stomach acid. Is that how they work?
Well, both the medications like Zantac or ranitidine and Prilosec or omeprazole, they both decrease acid production. The Prilosec is much more powerful. And when it comes to treating acid disease in the esophagus, that's really the treatment of choice.
Okay. Is acid reflux something that's probably hereditary, do you think? If your mom, you know.
If people have or develop hiatal hernias,
Okay.
which is an anatomical structure, what's basically happening there, at the end of your diaphragm, your esophagus comes down and dumps into your stomach. There's a little sphincter muscle there that when food goes in, it should close, digestion should occur, and life is good. However, sometimes that stomach will slip up through that hole in the diaphragm and will develop some of the stomach up above the diaphragm. Now you have an hourglass effect. So you have a little bubble up here, stomach, a narrowed spot, and stomach down below. And food can't get all the way down in there. Or if people overeat, it kind of accumulates there, gives them a very full feeling, but that food is sitting in contact with the esophagus. Some of that is genetic. People will have a tendency to develop hiatal hernias.
Okay. Is that something that can be cured with surgery, or if you have that? you're just stuck with it?
Yeah, there is a surgical procedure that is done laparoscopically. In severe cases, we use it. But even people who have surgery still need to take medication oftentimes into the future.
Okay, but you probably see there are certain foods, and people know that if they have heartburn, certain foods probably cause more acid reflux.
Sure, acid-containing foods.
Right.
Okay, so the citrus juices that are containing acid, lemonade, orange juice, grapefruit juice, they tend to cause more difficulties.
Okay. Well, we've talked about stuff in the stomach. Let's move the discussion a little further south.
These are all good places.
To a place where, you can have other issues. And IBS, or irritable bowel syndrome, is another common one. Tell us what that's all about.
Well, it's extremely common. And I think that probably everybody has experienced some sort of irritable bowel or spasm in their colon, or whatever you want to call it. Extremely common in our society. And again, carbonation is one of the main issues, because that air and gas has to go someplace. And if it's a sweetened drink, then you've got the sugar that maybe isn't fully digested, and the bacteria in your colon like to live on that, and they produce gas. So that creates even more cramping.
Okay.
There's been recently a diet called the food mop diet, and it restricts gluten, it restricts fructose away from the diet, and it has a high potential for people to feel better as a result.
And that's prescribed for people who have
irritable bowel syndrome.
Okay. How do you know, what are some of the symptoms of IBS?
Cramping, spasm, sometimes intermittent constipation and diarrhea. Diarrhea is usually the predominant symptom. It does not involve, though, bleeding. It does not involve weight loss. It does not involve significant prolonged pain.
Okay.
The classic symptom of irritable bowel syndrome is that people feel better once they relieve themselves. And if that type of thing doesn't happen, they need to see their physician. Colon cancer is extremely common in our society. It's the second most common cause of cancer deaths. And there is generally no feeling of colon cancer early on. Okay. And that's why we strongly recommend colonoscopy, starting screenings at age 50. And people who have a family history of colon cancer, they start 10 years before the youngest person in the family that developed colon cancer.
So if you have suffer from IBS a lot, can that lead to colon cancer?
Generally not.
Okay.
Those folks are no more risk for developing colon cancer than anybody else.
Okay. I want to get back to colon cancer in just a little bit, but first, tell us about IBS. What are some of the things that you can do to prevent it in the first place? Because obviously that's not a fun thing to have.
Yeah, and there's probably a significant genetic component to it. Besides the diet that we eat and the things that we drink, it sometimes isn't really totally controllable, and people have to seek treatment. And beside changing diet, there's medications that can be used. It's not a hopeless situation, and it can cause a lot of discomfort, but it's worthy of treatment.
Okay. So what are some of the treatments for that? You can change your diet, be more careful about what you eat, but if someone comes in and they've tried all that, what are some of the things that their doctor can help them with?
Well, I generally, first of all, look at medications that they're already on, because sometimes other medications, like used for blood pressure or used for other conditions, can make the bowels less happy. So that's one thing, is looking for other medications that might add to the symptoms. There's other medications that can help reduce the spasm of the colon. And they can sometimes be helpful, particularly in mild cases. So there's a medication called Lotrimox that's used that can help stop some of the biological spasms that can occur. It can't be used in people with constipation, so it's a limited access type of medication. So again, I want to leave people with the idea that there's hope for irritable bowel syndrome. It can be treated.
Okay. How do you know if what you have is really irritable bowel, or if it's just an occasional you know, a lot of people say, well, I have that, I must, you know, maybe I need to go get some medication for that. When do you know this is pretty serious and I should get?
Yeah, I mean, generally people with irritable bowel have a lifelong history of it.
Okay.
It starts when they're younger, it continues on sometimes their whole life. And so they're used to the symptoms. They're used to the diarrhea, constipation type of problem. It usually is not something that comes on in midlife. It usually is not something that starts at age 50. So those type of folks got to start looking for other causes. And there's celiac sprue is an example of a condition in which people cannot digest gluten.
Right.
It creates a lot of gas, it causes pain, it causes diarrhea, and again, it's very treatable with changes in their diet. So there are other causes, and I would encourage people to see their physician to talk about those things because it certainly can be related to their discomfort.
Right. Well, let's get back to colon cancer. That's an important one. Tell us, what are some of the warning signs of colon cancer?
Well, the most common is nothing.
And that's what makes it really dangerous.
That's right. The most common is no symptoms at all. People are trucking through life and they have a routine colonoscopy and there's a colon cancer. And the longevity is directly related to the time of diagnosis. So our goal is to find polyps because we believe that a polyp develops, a polyp is a growth, a neoplastic growth. It is growing faster than the tissue around it. It takes probably between 6 and 10 years for that polyp to become cancerous.
Okay.
How many polyps become cancerous? We really don't know. The study really can't be done and no one seems to be volunteering.
Right.
But those polyps should come out and then a follow-up should occur. So early diagnosis of precancerous polyps reduce the risk for colon cancer. So somebody who gets abdominal pain, irritability, blood in the stools, those are all classical warning signs and should not just assume it's hemorrhoids because people with colon cancer also have hemorrhoids.
Okay, so be very careful. Is the only way to test for colon cancer colonoscopy?
There are other techniques that look at the full colon, barium enema, sigmoidoscopy, but really the only true way to do is look.
And you said it before, but say it again. What is the recommended age for men and women to get a colonoscopy?
Presently, the American Cancer Society recommends at age 50 the first colonoscopy routinely. So if no symptoms, that's when you get it done.
Okay.
Then every 10 years up until age 75 or 80, and then after that, surveillance is indicated in people who've had previous negative tests. If a polyp is found and it's a precancerous polyp, if it's real small, then we kind of push it out 5 years. If it's of significant size or has kind of what we call dysplastic changes, then every 3 years.
Okay. What if you have a family history of colon cancer? What's the recommendation there?
If the person in the family, first degree relative, has colon cancer, say at age 51, then you would start 10 years before at 41.
Okay.
So it's a 10-year time because we believe that's about the length of time these polyps take to become cancerous.
Okay. We often hear that, make sure you eat enough fiber, that prevents colon cancer. Is that true?
There is some truth to that. In societies in which meat is not eaten, and we're in the heart of beef country here, so I'm going to be careful what I say, but we truly have an increased risk of colon cancer because of the meat products that we eat. And red meats, especially in certain ways that they're cooked, tend to increase the risk for colon cancer.
So how much, but fiber,
fiber.
It pushes that all through and gets
fiber
rid of
helps
all
push
that.
it through. It probably absorbs some of the carcinogens that's in some of the meats that we eat.
So what's the recommended, as long as we're talking about fiber, because that helps in a lot of ways, what's the recommended amount of fiber we should be eating per day?
Lots.
Lots? I'm not going to put you on the spot.
Well, and you have to be careful with that because there are people with gluten deficiencies who fiber makes them sick.
Right.
And so if they tolerate the fiber well, you really can't eat too much fiber.
Okay. So why is it that, not eating enough fiber and having all that material in your colon, does that lead to colon cancer? That if you're not being cleaned out on a regular basis, is that what?
I don't think
don't-
that's probably any evidence
Okay.
that occurs.
Okay.
People with constipation, for instance, really don't have any higher incidence of colon cancer
Okay.
than people who don't. And in fact, people with constipation may more likely seek care from their physician, more likely to get examinations of their colon done than people who have perfectly normal bowels and don't seek care from their physician and kind of forget the age 50 thing and end up with a disaster.
Okay. Well, let's talk about, this is kind of going back a little bit.
I do want to point out, though, colon cancer is curable in its early stages.
Right.
And so that's the reason we do this. And in the late stages, it's much more difficult to get into remission.
Because what is the procedure if you find it in the early stages? How do they treat that?
Well, oftentimes we'll take out a big polyp right through the endoscope, and the cancer was within the polyp, and it essentially cures it. If it's into the wall, then it takes a surgeon to go in and take out a segment of the cancer. If the cancer gets through the wall of the colon, it's likely going to be in the lymph nodes, and then that takes surgical procedure plus a medical oncologist to treat.
So catch it early and...
Catch it early, mainstay here.
Yeah, okay.
So weight loss, abdominal pain, rectal bleeding.
Keep those in mind. Excuse me. Let's talk a little bit about something we see on TV a lot, and that's these things called probiotics. It's not something we really saw, I don't know, 5-10 years ago, and now they seem to be putting probiotics in all sorts of food. What is a probiotic anyway?
A probiotic is a bacteria that typically normally lives, usually lactobacillus of some sort, that's been cultured and is put into either a pill or sometimes a yogurt or other foods, and you digest them and they kind of live in your colon. The idea is that the good bacteria, the lactobacillus, kind of the stuff that's in mother's milk, lives there and fights off the bad bacteria, which tend to create gas and discomfort. So there is some truth to the use of probiotics in irritable bowel syndrome and the discomfort that people have.
So is it, can it hurt by taking it? I mean, any side effects of eating maybe a yogurt product that has probiotics in it?
No, I don't think there's any risk really, unless you've got a bad product. I mean, if you've got one that's not been refrigerated properly, or you get essentially a food poisoning from it, yeah, that can cause trouble. But we seldom see issues with that.
Okay. So let's, we got about 4 minutes here. Let's talk a little bit about, just give our viewers some easy do's and don'ts when it comes to our digestive health, things that we can do right now, implement into our lives so, maybe we're not at the doctor, or things that you tell your patients when they come in and say, Dr. Good, I've got, I constantly have heartburn. What am I doing wrong? What do you tell
Well, the
patients?
treatment for heartburn is, one, stop the carbonated beverages.
But I don't. What if someone doesn't drink that? What if they're not? Oh, I don't drink any soda.
I'm getting there.
Okay.
2, elevate the head of the bed.
Okay.
That's a simple thing, because gravity has a lot to do here. Reflux is a mechanical problem.
Okay.
You've got acid from the stomach or food substances getting into the esophagus where it doesn't belong. So you want to keep the head of the bed elevated. Don't eat or drink within 2 hours of bedtime.
Okay.
Keep the stomach empty when you go to bed at night.
That makes sense.
Pretty simple things. And then if there's foods that bother you, don't eat them.
That sounds simple enough.
and certainly excessive amounts of alcohol, particularly if it contains carbonation. It's not just soda, it's carbonation that causes the problem.
Beers and anything carbonated.
Beer in quantity, or large quantities of any fluid, even too much water, can cause reflux disease.
Okay.
So that's kind of...
It's pretty simple.
Well,
or it can be.
It can be. Yeah.
What about if you've got, suffer from maybe IBS or diarrhea, constipation? What are some things that we can do to sort of make that process a little more normal?
And again, I think the carbonation is right at the top of the list. Eating foods with lots of fiber and evaluating that at least once in your life. If you have irritable bowel syndrome, or you think you do, to at least once get to your physician and get it evaluated, because it could be something else, and it could be something very treatable like celiac sprue.
Okay. And finally, at 50?
Colonoscopy. Or before that, if there's a family history. Or before that, if there's rectal bleeding. Don't let rectal bleeding go unchecked or unknown. It needs to be evaluated.
Okay. Well, thank you so much for coming on and sharing good information with us. We'll make sure we get enough fiber. Don't drink so much pop, soda, and if it gets serious, we'll come and see someone such as yourself.
That would be good.
Thank you, Doctor.
All right, thank you.
Don't forget, you can watch more Being Well online anytime. Just visit our YouTube channel at youtube.com/WEIU-TV. You can watch full episodes plus demonstration segments from Season 1 and Season 2.